Hello, my name is Yoania. I'm going to be your nurse practitioner student today. What is your name?
Ignacio Medina.
And tell me why you're here today.
For cardiovascular exam.
Okay, before we get to that, I'm going to be asking you some questions. Do you have any shortness of breath, chest pain, any difficulty walking?
No.
Do you have any family history of cardiac disease, sudden death?
No.
Do you smoke?
No.
Drink, high cholesterol?
No.
Okay, so I'm gonna do the cardiovascular exam, and I'm gonna be asking you to lay down at some point. You will need to stand up. I'm gonna be using my stethoscope, the diaphragm for the high pitched sounds, and the bell for the low pitched sounds. So I'm gonna be asking to lay down. I'm gonna inspect your chest for any deformity, any irregularities that you may have, any scoliosis. Okay, I'm gonna ask you to lay down. And I'm gonna put the head of the bed 30 degrees with the pillow down, con the pillow under your head. And I'm gonna be looking for the jugular venous pulse with the pain line tangential, so I can see for any contour. And I'm gonna be looking for the point of maximal oscillation. If the point of maximal oscillation is flat or it is elevated, then I'm gonna perform the jugular venous pressure, which is I'm gonna have a rule put it here in the angle of Lewis parallel to the wall, okay? And I'm gonna have another ruler like a 90 degrees, and a normal value should be 3 centimeters. And if I measure from the right area, a normal value should be less than 8 centimeters. Now, I'm gonna palpate the carotid. One at a time. I will never massage the carotid. I will palpate them one at a time. And I'm gonna palpate the apical pulse. I'm gonna have the patient tilt a little bit to the left side. And the apical impulse is going to be in the mid-clavicular line, 5th intercostal space, and it should be 2.5 centimeter. If it's more to the left, then I'm going to be thinking of differential diagnosis of left ventricular hypertrophy, and if it's more to the right, it's going to be most likely a differential diagnosis of ischemia or COPD. Then, if you can do supine position again, I'm gonna do the hepatojugular reflux. So I'm gonna look for the rib cage. I'm gonna press the lever, and while I do that, I'm gonna look for the jugular vein, and if it should engorge when I'm doing this. So when I release the hand, should go away. If the jugular vein does not go away, then it's indicative of right side heart failure. Then I'm going to auscultate, if you can please sit. I'm going to auscultate the valve. I'm going to start by the aortic valve that is in the second intercostal space, right external border. Then I'm going to auscultate the pulmonary valve, which is in the second intercostal space, left external border. And the tricuspid is in the 4th intercostal, left external border, and the mitral, which is in the mid-clavicular line, 5th intercostal space. Okay, also I'm gonna be listening for S1 and S2. So S1 is best listened in the apex of the heart, which is the mid-clavicular line, 5th intercostal space. That's where we best listen to S1, and to know if it's S1, we can also listen while touching to the carotid and listen to the pulse, so that way I know that it's S1, and S2 is best heard in the base of the heart. So there's also S3 and S4, both of them are best heard in the apex of the heart, and I can listen to them with the bell of the stethoscope because it's low pitched sounds, where S3 is right after S2 and S4 is right before S1. Also, I'm gonna look for murmurs. To look for the murmurs, I need to know where the murmurs are located. When I identify what the murmur is, then I need to know if it's a regurgitation or is stenosis problems. And the only way that I know that is know if the murmur is happening during diastolic or systolic. If the murmur is happening during diastolic, then it's gonna be a stenosis murmur, which is problem with the opening of the valve. If it's during systolic, then it's regurgitation problem, which is a problem with the closure of the valve. Then I'm gonna classify those murmurs, grade them between 1 and 6. If it's a 4, a murmur 4, then I'm gonna feel the trio. It's gonna have the trio, and I can feel it with the fingers of the stethoscope. And if it's 5, I can just feel with without even putting the stethoscope in the skin. And if the murmur is rated 6, then I can just listen to the murmur right side to the patient. Okay, so now I'm gonna perform the peripheral vascular assessment. So I'm gonna ask you some questions. Do you have noticed any edema, any skin discoloration to your extremities, your arms or your legs?
No.
No. Okay, so I'm gonna auscultate the carotid with the bell. Now I'm going to inspect the upper extremity, the hands. I'm gonna be looking for any edema, any skin discoloration, any lesions, and I don't see anything. So now I'm gonna look for the pulse. I'm gonna assess the pulse of the patient, the radial pulse, and then the ulnar pulse, the brachial. Okay, and now I'm gonna inspect the legs of the patient. I'm gonna inspect the legs of the lower extremity, bilateral, of the patient for any edema, any shiny skin, any how is the hair distribution, any lesions. I'm gonna be looking at the calf. Now I'm gonna measure the calf. To measure the calf, I'm gonna locate the palate, patella, and I'm gonna go down 10 centimeters, and there's where I should measure the calf. Then I'm gonna, if you could please stand up, look for the femoral pulse. The femoral pulse is gonna be right here between the iliac point and the symphysis pubis point, right here. Then, if you can please turn, I'm gonna look for the popliteal, and it should be right here. If you can please see it. And I'm gonna assess the pulse in the dorsus pedalis, and the posterior tibialis. Then I'm gonna assess the patient for the Homan side. If you can please lay down. I'm gonna have the leg of the patient, and I'm gonna dorsiflex the leg. If the patient has calf pain, then most probably he has a DVT. Okay, and then I'm gonna calculate the ankle brachial index. To calculate the ankle brachial index, I'm gonna take the blood pressure of the right arm 2 times, and I'm gonna add the systolic value and then divide it by 2. And I'm gonna do the same here. I'm gonna take the blood pressure 2 times on the left arm, and I'm gonna have the systolic value. I'm gonna add those numbers and divide it by 2, and I'm gonna stay with the highest value. And then I'm gonna put it in the denominator of the equation. Then I'm gonna do the same in the ankle. I'm gonna take the blood pressure of the ankle with the dropper 2 times, and I'm gonna have the 2 values, systolic value divided by 2. And then I'm gonna do the same on the left. I'm gonna have to take the blood pressure with the dropper, take the 2 systolic value divided by 2, and I'm gonna have the highest value. So the highest value, I'm gonna put a numerator. So when I divide the equation, the value for a normal value should be between 0.9 and 1.3.